I'd like to thank everybody for coming. I'm running as a can you guys all hear me? I'm running as an independent, and I think it's important that you know why I'm running as an independent. This is just for the camera. So I want you to know that I lost my son 7 years ago to the toxic supply of drugs. Ryan was 26. He'd been in recovery for 8 months. He'd relapsed. He'd gone back to work, and he died on his job site. And since that time, there's now 15,000 people have died the exact same way as our son in our province and 45,000 in our country. And there isn't a party provincially or federally that is acknowledging how these people have died, and nor are they providing a solution to stop these people from dying, because these are preventable deaths. And my wife and I have had not anybody to vote for since we lost Ryan. So I've put my name forward to run as an independent because I want to acknowledge the reality that these are preventable deaths. So a lot of the questions that I'm going to answer to are going to come back to why I'm here, because it is related to a lot of these questions. The first question, the food policy, and as an independent, I just want to be upfront. I don't have party policy to answer all these questions and speak for 5 or 6 minutes. It's just not reality. I will do my best to tell you how and what I think of it. And if there's any question or I don't give enough information, I have a website. You can just shoot me an email on electjohnhedican.com and I'll do my best to answer it. But I was invited to the BC Agricultural Council just when the writ was dropped. And I drove down there and listened to the organization, the invited candidates, and a number of farmers from Mid-Island to attend it. And they shared all the concerns that they face as farmers, from climate to pricing to trying to find workers. There was just a number of issues that they face. And one of the biggest ones, she said a lot of these farms are family run, and they've been in the families for generations. And what they're finding is kids are looking at what their mom and dads are doing, how hard they're working, and what they make to do that, and they go, why would I want to do that, mom and dad? Just because of the issues that they face. So it's, as a candidate, I would advocate for these concerns that the council came up with, and that's how I would start to address that question. All of these questions that I'm going to be asked all come back to funding, and where do we get the money to fund all these, because they're all expensive issues to fund. And I'm going to tell you that I think we all face the same thing, that we're taxed enough. And that's how governments fund, is they raise taxes. They're not good at making money. So I look at the amount of taxes we spend fighting a war on drug users, and we've been doing it for over 80 years. And what's the benefit of those dollars spent? And I look at the vast amounts that organized crime collects, and I say that we should be taxing those amounts through the legalization of drugs. And with those two income streams, we would actually have vast amounts of money to fund these issues that need to be funded. And we need to acknowledge that we have two systems in place, alcohol and marijuana, to show us how to collect that tax revenue. And that's reality. And our provincial parties and federal parties are not addressing that reality. We just continue to spend billions and billions on fighting the war on drug users. And I had one person from the previous person ask me, well, how much do we actually spend? And I've looked and I haven't been able to find that number, but I can give you one little example. In 2001, our provincial government formed the BC Special Forces Unit, and it's 200 RCMP members made up of people in RCMP in every community in our province. And they were formed to fight and combat drugs and gangs. So the cost of 200 RCMP officers, just the direct cost of that, for 25 years, and what has it changed in our communities? And what could we have spent that money on otherwise in our communities that would have made a change? So many. And that's just a little example of the dollars spent. And our provincial parties aren't talking about that. And it's reality, and it needs to be talked about, because we need massive funds to address all the issues that we're going to talk about tonight. So it's that's.
All right, candidates, wrap up your question. I'm just going to give you a few seconds here, and I'm going to start the next question. Second question tonight comes from the Comox Valley Social Planning Society. The current earnings exemption limit for those receiving benefits from the Ministry of Social Development and Poverty Reduction does not meet the needs of people receiving the benefits, and it is unnecessarily bureaucratic in practice. If elected, what would you do to support the call from 50 nonprofit leaders, advocates, and community partners in the anti-poverty and disability rights sectors to abolish the earnings exemption limit for people receiving income assistance, including those with persistent and multiple barriers and those who are receiving people with disabilities benefits?
There again, how does that get funded? There are so many wants and needs to people fighting disabilities for access to programs, to supports. That my wife is in the school system, has been for a number of years, and she talks to me about, people with disabilities that are funded while they're in school, then they hit 18, and that funding is taken away. So these are all things that need to be funded. And as an independent candidate, I would have the ability to support policy that came from the left or from the right. Not all good policy comes from the right or the left. And I would advocate through policy brought forward by them. And I would also seek out those 50 organizations to find out what priority they had and what the needs are to be addressed. So to try and pretend that I'm knowledgeable on that, I'm just not. I don't have a party policy that addresses that, and that's what I would do. So I can't carry that one on any farther. I don't know if there's any questions that I could answer to that. Sorry, go ahead. A vote for me would send a message to not only our provincial parties, but our federal parties, that allowing 15,000 people to die the exact same way, a preventable death, is unacceptable. A vote for me would help send a voice that the prohibition of drugs directly supports organized crime, because it ensures they are the only game in town. And that's just the reality of the prohibition of drugs. And they thank us for that. And it would send a message that we don't support organized crime, and we don't support wasting tax dollars year after year to the tune of billions upon billions that changes nothing in our communities. And when politicians see votes, they will change and acknowledge because they need to get in front of votes. And right now they don't see votes when they look at substance users. They just don't. And until we show them that it's unacceptable, that they're allowing people to die these preventable deaths, and there's nothing, the only thing that changes is the number of people that die, the toxicity to the drugs, and the amount of wasted tax dollars. And that your vote would help me send that message. And I don't ask for your vote lightly. My vote is important to me, and your vote is important to you. But it will make a difference. And you're not only supporting and trying to prevent deaths today, This will try and prevent deaths from future generations, because as long as organized crime is providing drugs, your kids, your grandkids, and your great-grandkids are all going to be at risk of dying. And that's just reality. And we haven't acknowledged reality for decades, and it's gotten us to where we are today. And that's what I'm trying to do, is acknowledge reality, and a vote helps force these parties to look in the mirror, because they are not addressing reality.
Candidates have 1 minute to wrap up.
We don't talk about the parties that are calling for recovery as the means to stop these preventable deaths. Recovery is an 80-year-old faith-based 12-step program that tells the user to stop having their disease. There's no medical intervention, and it's gotten us to where we are today. And we need to invest those funds in medical research so that we have medical intervention. We don't treat cancer patients the same as we did 80 years ago, and we don't just tell them to stop having their disease. And it's part of that message that we can send to our provincial and federal parties with a vote.
Okay, candidates, that's the time. We're going to move on to the next question. This question comes to us through the Comox Valley Early Years Collaborative. Given the success of the current Child Care BC plan, including $10 a day childcare, and the immense positive impact it has had for families with young children, what do you intend to do to make sure that A, the current plan continues, with a dramatic increase in the number of high-quality $10 a day spaces, and B, if you have any future plans to include a fair wage grid for early childhood educators, including access to quality post-secondary training?
100%. I mean, yeah. I mean, what else could you say? It's obviously needed. I am going to repeat myself many times. It comes back to funding. Where do the dollars come from? We all know with the cost of having a family that $10 childcare is needed, and it has to be subsidized, and to not is not acceptable. So yeah, that's it's pretty straightforward. It's just something that has to be done. I just can't tell you the fine details as to how these parties would do it, but it would be something that I would advocate for, and something that I would try and hold the other parties accountable for. And one thing about an independent MLA is we're not tied to party policy. We can support good policy as long as it represents all British Columbians, and this is so needed. They're also going to they talk about retaining educators to do this, and the way to do it, I believe, is they would have to be treated like teachers in order to keep people in that position. They have to be paid a wage, and I believe that position would have to have a pension, and you wouldn't have people coming and going from that job. They would stay. There again, that's funding, and it's a lot, and we just can't keep raising taxes to cover all these issues that desperately need to be funded. And the prohibition of drugs would provide that. So it's just a policy that I would support. Yeah, I did that. I toured a number of schools from Nanaimo to Port Hardy after I lost Ryan. We lost Ryan, and I wanted to get in front of students. I wanted to get in front of educators for different reasons. I wanted to get in front of students because I wanted them to hear how choices affect their lives. And I also wanted educators to not view and judge kids that struggled for various reasons because they didn't know their story. And I also wanted kids to know that came from families that struggled that they weren't alone. And that it was a disease, not a choice. And we have to have empathy and not judge when we don't know a person's story. And we also need to educate kids better on the harms caused by alcohol. We pick on drugs and we don't talk about alcohol, and it's the gateway drug. As a recovering alcoholic of 37 years, I can tell you I wouldn't have tried cocaine if I wasn't drunk out of my mind. And that's just the reality of alcohol. We put it on every corner, and we normalize it and glorify it and put it in shiny retail stores and have nice commercials on TV. But the reality is, it is the gateway drug. And our kids need to be educated on that. And it needs to be done by people with lived experience, not RCMP officers or people of authority that just say stop and don't do it. And we need to invest in that so much because kids need to hear it, and it's something that we're not doing. There again, we need to fund it. And I was told, and when I did it for I think 50 schools, and I told our Minister of Mental Health and Addiction I needed her to fill my gas tank to drive up and down the island. And she told me she didn't have a way, the Ministry of Mental Health and Addiction, of funding that. And I said, you don't have to find a way to fund my gas tank. You need to find a way to find 50 people to tour this province to talk to kids. And not only kids, we need to have people with lived experience going into nursing schools, doctors, social workers, RCMP, paramedics, and talking about the realities of addiction.
All right, candidate, to wrap up your sentence, please. We're going to move on to the next question. The next question comes to us from the Immigrant Welcome Center. Between 2016 and 2021, 775 new immigrants came to the Comox Valley. How do you feel our community is doing in welcoming newcomers? And what recommendation do you or your party have around immigration going forward?
I would visit the Immigrant Center, speak to immigrants, ask them what their barriers are, what needs to change to help them assimilate into our communities. We need to find a way that these immigrants that are coming into our country that are trained, medical, paramedics, whatever the case may be, to have that training transfer into our province to help with the shortage we have. That's where I would start. They face the same danger as everybody in our society of toxic drugs, and that's being at risk of dying. Immigrants use drugs as well, and they need to know that coming into Canada, they are at risk of dying, and that needs to be part of our welcoming information, and we're not doing that. So I wish I could speak for 6 minutes on this, but I just don't have it in me to talk about 6 minutes of how we help our immigrants. They are needed, and they are valued, and we have to find a way to help them, like I said, assimilate into our communities, because we're not going to grow without them, and so many of the jobs are not getting done without them. Yeah. We talk about the toxicity of drugs, and I'm going to keep going back to this because it affects so many things. We have all these mental health issues that are affecting our communities that didn't affect them 10, 15 years ago. Cliff Avenue did not look the way it does now 10, 12 years ago. And we're not acknowledging that the drugs of today have knocked people out for 2, 3, 4, 5 minutes, has robbed their brains of oxygen. And they now have severe mental health issues that look far different than 10, 12 years ago. And then we have toxic drugs on top of that. And we say, holy cow, like our communities are just chaotic. But we're not acknowledging why, what has changed. And we're talking about involuntary care when we don't have beds or the medical professionals to address the people that are seeking mental health help right now. And we're going to put all these extra forced mental health people where there's no beds and no doctors. And we're not addressing the toxicity of those drugs. So until we address that and acknowledge why, it's we're just trying to pull some bodies out that are coming down the stream, and we're not addressing why they're getting in the stream and the severity of the mental health issues that we're seeing today is directly related to the toxicity of the drugs. So just another reality that is not acknowledged by our political parties. They just want to talk about funding beds, and it doesn't address what's causing people and why we need these beds. So it's just more tax dollars that will not change what our communities are seeing today. And it's just reality that hasn't been addressed. And here we are today. I don't want me to get cut off when I start here, but our parties that are calling for recovery as the means of be-all, end-all to stop these deaths are not acknowledging that it has a 92% relapse rate. So we're going to spend all these dollars funding beds, knowing that 92% of the people are going to relapse. Don't move, yeah.
We just need one more moment to get the camera connected over here.
Just while people are settling, I also just wanted to mention for folks that are listening to please give the candidates an opportunity to fully answer the questions, and then if there's time after, please ask your questions. So please give the candidates time to fully answer the questions.
And from our film people, can I just get a thumbs up that we're ready to go? Bob, Connor, ready to go? Yep. Fantastic. Okay. We're going to move on to the next question. This question is from the Pride Society of the Comox Valley. Across Canada and the USA, various governments are creating legislation to minimize the rights and safety of queer and trans people, or they are taking steps to outright ignore current legislation meant to support the legal rights and safety of queer and trans people. In Canada, we have seen such actions in New Brunswick, Saskatchewan, and Alberta. First, what specific steps will you take to ensure the elected governing party does not try to eliminate the legal rights of queer and trans people, including youth, in British Columbia? Second, if you you are a member of the governing party and the party tries to minimize the rights of queer and trans people, how will you stand in opposition to your party? And finally, if you choose to follow the lead of a governing party in minimizing or eliminating the rights and safety of queer and trans people, how should your constituents hold you accountable?
Hello, welcome. I think it's important to tell you before I start why I'm running as an independent candidate. We lost our son Ryan 7 years ago to the toxic supply of drugs. Ryan was 26 years old. He'd been in recovery for 8 months and gone back to work as a third-year electrician. And he relapsed on his job site and he died. And Ryan is part of 15,000 people in our province to die the exact same way, and 45,000 people in our country to die the exact same way. And our current provincial and federal parties are not acknowledging how these people have died, a preventable death, nor are they providing a solution to stop these people from dying a preventable death. And I'm running as an independent candidate, because my wife and I have had no one to vote for since the loss of our son, because there's nobody talking about how they died and how to stop them from dying. And reality is not being addressed, and that's why I'm doing what I'm doing. And as an independent candidate, it's really hard to, without party policy, to answer a question and talk for 6 minutes about something that I don't have the expertise or party policy to do that. But I am going to try and answer the questions the best I can. And I want you to know that I am asking for your vote, and I want you to know why I'm asking for your vote. I believe that all of our parties, provincially and federally, do not see votes when they look at substance users. And if I can show them votes, they will get in front and make changes to these preventable deaths. And I don't take asking for your vote lightly. Your vote is important to you, as my vote is to me. And I'm hoping you'll consider helping me send a voice to our provincial and federal parties that letting people die a preventable death and wasting tax dollars is not acceptable. So to answer this question on pride, I support diversity. I would call out any party that did not. And as an independent candidate, you don't have to follow party policy. You can support policy on the right and you can support policy on the left. And if it's good policy that represents all British Columbians, I'd support it. And I would call out as loud as I could any policy that didn't. It's a part of life, diversity, and it has to be acknowledged and not politicized, as some parties do. And that's where I would stand on that question. And I'm going to keep repeating myself that all of these questions, they all require funding, vast amounts of funding. And where does funding come from? Our governments love to spend money in election times. They're going to do this and they're going to do that. And they're going to spend billions and billions, but they're not going to raise taxes. Well, that's where it comes from. But I call for the legalization of all drugs, because it is the only policy that addresses the reality that drugs like alcohol have and always will be part of life. And we spend billions of tax dollars, decade after decade, fighting a war on drug users that has changed nothing in our communities other than the amount of people that are dying and the harms being caused. And we need to acknowledge that, and we need to look at the vast amounts of sums that organized crime collects. And those sums need to be taxed like we do for alcohol and marijuana. And if we tax those sums that organized crime are collecting, and we save the dollars that we spend that changes nothing in our communities, funding a war on drug users, we would have two massive streams of revenue that we could actually invest in our communities that would make a difference. And it would address reality. And it would remove organized crime. Because right now, our federal drug policy 100% supports organized crime. It ensures they are the only game in town. And we spend billions supporting them. It's crazy. They can't believe they've killed 45,000 Canadians, 15,000 in our province, and we're not talking about them. They just keep doing what they're doing, and they will always have substance users to poison, because there's a new grade of grade 10s coming and 11s and 12s, and that's just going to keep continuing. It's not going to change. We can fund all the beds we want, but until we address what's killing people, we're just putting a little Band-Aid on a massive wound, and we're not acknowledging reality. And it's a hard thing for people to wrap their head around in some cases. And I'll say to them, I wish there were no drugs or alcohol on our planet, but that's wishing. And that's what our federal drug policy does. It's a fantasy policy that wishes it could stop drugs from coming into our community, and it'll never stop it.
Is coming to us from the Comox Valley Coalition to End Homelessness, and here's the question. It's about the affordable housing gap. So even quote-unquote affordable housing options often remain out of reach for many who are the most vulnerable. What specific policies or programs would you support in order to support those who can't afford existing affordable housing options?
We have to find a way. We have to find a way to get people out of tents, because they don't have a chance living in a tent. I don't know how any of you would function and how you would survive if you had to live in a tent, let alone having any mental health or addiction issues. Just living in a tent to try and do that. Couldn't do it. So there's a great video, and it's called Elvis Has Left the Building. So if you type into YouTube, Elvis Has Left the Building, Port Alberni. It's a 9-minute video shot in Port Alberni. And there's a man named Elvis that's lived under a bridge, and he's fought alcohol issues and substance issues. And Elvis has been put in an ambulance, police car. He goes to the emergency ward on a regular basis, and it's just a revolving door for Elvis. And they find Elvis a place to live. It costs $425 a month, and it's a bed, and it's a couple of chairs, and a little kitchen and a bathroom. And that gave Elvis a place to live, and Elvis stopped getting in the ambulance, stopped getting in the police car, stopped going to the ER ward at a cost of thousands and thousands of dollars for $425. So until we give people a place to live and a chance to start, we're not going to address them. We're not going to help them.
So what other alternatives do you see to addressing getting people out of tents besides foreign accommodation?
So this fellow's asked me what other ways do I see of getting people into housing. These people that are living in tents, it has to be subsidized. It has to be. Like, how else are we going to get them in there? They don't have the funds. They're not working. How do you have a job and live in a tent? It's not reality. We have 2 modular home builders in the Comox Valley. We need to build small modular homes. We can either spend the money doing that, or we can spend the money sending them to the ER ward and having our police and bylaw officers and just all those costs that are far more than building a modular small space for these people to live. And I believe that's our choice.
Small modular homes then?
Yeah. And I think municipalities have to play a role in this. We look at costs of housing. Our provincial governments need to play a role in this. Removing red barriers, red tape, and there's many things that we can do. And governments can, when they want, they can change policy. They can show action, and we saw that when COVID hit. Overnight, we were wearing masks, social distances, business closed. It changed overnight. And when the Coquihalla Highway washed out a couple of winters ago in the middle of winter, we put the Coquihalla back together in 3 to 4 months. It just happened. So when government wants, they can move. But I say when they look at substance users, they don't see votes. And here we are.
So have you looked at other parties' policies? Which one would you support if you were our MLA?
I don't support policy as in regards to
NDP, conservatives, they all have policies on housing. Have you looked at any of those? Would you align yourself with any of those where you are?
I haven't. No, honestly, I haven't looked at all their parties, and a lot of times, unfortunately, they just tell us what we want to hear.
Candidates have 1
Excuse me. And when they get to either Victoria or Ottawa, then those promises, and who's to to call them out on it.
So if you were elected, you'd be an independent voice that would serve.
That's 100% with extremely clear language. It wouldn't be political rhetoric. I would call a spade, and I would advocate, and I would demand accountability, because there's no reason why we can't. They've shown us it can happen overnight. And right here in the Comox Valley, we have 2 businesses that would create jobs. It's inexcusable. It is a heartbreak to drive down Cliff Avenue and look at what people are doing. It's a heartbreak. Those are people. Yeah. And it's preventable, and it's treatable, and we're just allowing it to happen, and it's politicized.
Okay, candidates, that's time for that question. We're going to move on to the next question. The next question comes to us from the Comox Valley Senior Support Society. So here's the question. A significant number of people, including children, youth, adults, and seniors in the Comox Valley, do not have equitable access to many activities or services. In June of 2021, the provincial government passed the Accessible BC Act. This requires local governments and organizations to take action on accessibility in communities across BC. If elected, what will you do to work with all people with disabilities in our community and with local governments or organizations to achieve accessibility and universal access for all members of our community?
Yeah, I just don't have policy on that question. I know our people with disabilities are not funded. A lot of them, we look after them during their school years, and then when they hit 18, we pull that funding back and we leave it up to the families to figure out how they are to look after their family members with disabilities. And I believe that has to be funded. There again, how do we fund that? Take the tax dollars that we're wasting, collect the revenues that organized crime's collecting, and we could actually fund issues like that. I look at our seniors and I wonder, seniors without pensions, how do they survive on a Canada pension and an old age pension with today's costs? They've never had a home, they rent somewhere. How do they eat? I mean, Canada pension, old age pension, that's not living. And without that pension, so how do we subsidize that? Because it should be subsidized. Our seniors shouldn't have to get to be 65, 70, 75 and keep working, but that's what's happening today. Because our pension system, I mean, we have improved it, but it doesn't cover what they need. And that it's not talked about, but that's reality. There again,
Funding would help if there was increased funding for seniors, and you've also said that there's a way to get that funding by attacking organized crime and saving money on enforcement. What specifically do you have in mind in terms of those 2 goals that you want to reach with respect to drugs?
well, I want to tax the revenue like we do for alcohol and marijuana.
All drugs to be legal?
Yeah, 100%.
Every drug?
Pretty much. Yeah, why wouldn't you? You have to, because it's either we do it or organized crime does it. We can't pick and choose. We didn't legalize some alcohol and leave some out, because people are going to source it. So that's just reality. Yeah. So I don't know if you guys did you all hear that? You know, that's a great question. Scare the hell out of me too. And that's a legitimate concern. And what I would say is it is going to make accessible. But we've already put alcohol, the gateway drug, on every corner. We've normalized it. We've glorified it. I'm a recovering alcoholic, 37 years sober. I never would have tried cocaine if I hadn't had too much to drink. All my friends that tried cocaine wouldn't have if they hadn't had too much to drink. So the reality is, kids are going to try drugs. They just are. Many times because they've had too much to drink. So one, if we legalize it, your daughter is not going to die if she tries it. She's just not, because it's not going to be toxic. It's not going to be made by organized crime. It's going to be a 40-ounce or a 40 proof bottle of vodka. That's what you're buying. So you're going to be buying cocaine that isn't cut with fentanyl. And the other thing we have to do is we have to educate our kids right at elementary level to the harms and dangers of alcohol and drugs. And it has to be done by people like myself with lived experience, other younger people that are fighting addiction, have just come out of addiction or in recovery. It has to be lived experience people. And we have to do it like a full time. It has to be almost a course to give to these kids. And we're not doing it. But at the end of the day, we have to prioritize people stopping from dying, from people stopping to try, because they won't die. And they'll live to know that they shouldn't have done that. You know, right now they don't get another chance, and that scares me more.
Plans to increase involuntary treatment for those with acute mental health and substance use disorders, which many experts do not support, as the evidence shows poor rates of success. Further, there are often harms for human rights violations to higher risk of death from the unregulated drug supply. Do you support involuntary treatment? And if so, how will you ensure it will be effective, evidence-based, that it will minimize harm and will provide long-term success for patients?
So this question is a great question, and it's a complicated question, but it doesn't address why are we now talking about involuntary care, right? We weren't talking about involuntary care 10 years ago. And the reason we're talking about it is because drugs have become so toxic that many of these people have stopped breathing for 3, 4, 5, 6 minutes. And they now have severe brain damage for the rest of their life. And most are in the prime of their life, like our son, 26 years old. So what is the cost to our health care system for somebody that's severely brain damaged? That's why we have this issue. And we're not talking about why we have the issue. We're not addressing reality. Reality is the toxic drugs of today. So answer the question. We also don't have enough beds or medical professionals to address the mental health issues that we have now. And now our parties are saying we're going to involuntary care these people, and we don't have the facilities to address them. So how does that work? It's not reality. We don't have the doctors. They're just throwing out air.
Was your son ever in involuntary care?
No.
He did go into some programs.
He went into recovery twice.
What's your opinion on whether the effect of those programs?
It's not good. It has a 92% relapse rate because there's no medical intervention. It's the same policy. It's the same what we did 80 years ago. We tell people it's a 12-step program, basically faith-based, where we tell the user to stop using. There's no medical intervention. We put our son Ryan in Edgewood, supposed to be a world-class facility, at a cost of $13,000 a month, which we didn't have sitting in a bank account. We had to remortgage. And we were looked in the eye when we entered Ryan by one of the counselors, and she said, just so you know, Ryan is going to have a 92% chance of relapsing. And that's reality. So our parties that are calling for recovery as the be-all, end-all means to stop these thousands of deaths is recovery, something that has a 92% relapse rate. That's disgusting. It really is. It's a gut punch.
So if the recovery rate is so low, and you're not quite sure about the involuntary,
Yep.
because we don't have the healthcare piece, and you advocate on a platform of educating and decriminalizing drugs,
Legalizing. Yep.
what do you do with folks who are already in the throes of addiction right now who need their recovery? Because a lot of that is preventative. What do you do about the people who are currently in the midst of addiction issues?
Yeah. Great question. We haven't invested. I mean, we have to put them in recovery because it is a chance, right? People do stop using, stop drinking when they go into recovery. Not all people relapse. 92% do. It's the best we have because we haven't invested like we've invested in cancer and diabetes and every other disease. Addiction has been viewed as a choice. And that's the reality of why we are where we are today. So to answer your question, that's all we got. So when I wrote a check for 13 grand and my wife did, that's all we had. Right? We just were sick, but that's all we had.
What would you reference medical intervention that's missing?
Yeah.
What do you see as medical intervention?
If you have cancer, you got a chance of being chemo or radiation or surgery, and you can be cancer free.
Get that, but what would you do? How does that apply to drugs?
We don't have that. That's what I'm saying. We have to take money and we have to invest and find new ways of using actual medical intervention other than telling people to stop doing what they're doing. That's the reality of kids that become addicted today. As a parent, you're not equipped to help your son or daughter because you have to figure it out. Our system, you don't take your son or daughter to the hospital and say, my son's addicted and I need help and he is sick. That doesn't happen. They don't deal with that. You deal with it.
Fair to say that we're really just managing to have conversations around the kind of emotions that exist, the kind of hurt that exists that causes them to seek substances to feel better. Like maybe we haven't been brave enough to have conversations like that in the past. Maybe cultural abuse has been so severe.
I disagree.
All right, time, so we can
Just because I never had any abuse or trauma for me to when I use drugs. I just didn't. And the human nature is we will always seek pleasure and we will always hide from pain. So we like the taste of alcohol. We like how it makes us feel. Drugs are no different. We like how they make us feel. We're always going to seek pleasure. And we're hurting or we have anxiety or whatever the cause is that we're trying to avoid pain, we're going to use that to avoid pain. It's just part of life, has been for thousands of years. And unfortunately, I wish it wasn't, but that's just reality. Yeah. And my heart goes out to you for your daughter. Like you have to worry because alcohol is so normalized. And the kids that, 18-year-old student that lost her life in UVic this January, she's 18. She's not addicted. She's in a dorm at a university with friends. And she had too much to drink and she made a mistake and she died. And we're not talking about those people. It's like they don't exist.
Thank you, John, for speaking to us. Thank you.
Had enough sitting down for a while.
Yeah, it's been a long day. Yeah, you guys will have to forgive me if I lose. I've been talking since 3 o'clock.
I was going to say,
Yeah,
2 sessions like that.
yeah,
That's cool.
yeah. I'm getting tired of listening to me. That's okay.
Here we go. Okay, so this next question is a Comox Valley Food Policy Council question. So in budget 2023, the province of BC invested $214 million over 3 years towards school food programs. If elected, how will you support school food programs for students across the province and ensure that both legislative policy as well as funding is available and supported?
I want to start by telling you folks why I'm running as an independent, because I think it's important for how I answer these questions. And my wife and I lost our oldest son 7 years ago to the toxic supply of drugs. And our son was 26 years old. He'd been in recovery for 8 months at a facility in New Westminster. And he went back to work as a third-year electrician. And he relapsed on his job site and he died during his lunch break. And Ryan is part of 15,000 other people in our province that have died the exact same way, and part of 45,000 in our country that have died the exact same way. And I decided to run as a candidate because there isn't a party, provincially or federally, that wants to acknowledge these are preventable deaths, nor do they want to acknowledge what would have saved them. And we haven't had anybody to vote for since we lost our son. So I decided to run as a candidate to try and hold these other parties and the candidates that represent these parties accountable for not addressing these preventable deaths. Because these people should be alive today, the vast majority. And the vast majority, like our son, were in the prime of their life. They're not old seniors fighting whatever they were fighting. And it's just not being acknowledged. And it's hard. It's a gut punch to know that these lives are being disrespected and minimized. And I think it's pathetic and disgusting by the parties, both provincially and federally. So I'm calling for legalization of all drugs because it addresses reality. And the reality is drugs, like alcohol, always have and always will be part of life. And legalization, cleaning up the drugs, the vast majority of these people would be alive. We spend billions of tax dollars every year fighting a war on drug users. They're our family members. It's not a war on drugs. And the prohibition of drugs 100% supports organized crime. It ensures it thrives in every community across our country. So the billions of tax dollars we spend fighting them supports them. And they can't believe it. They thank us for the support. They've killed 45,000 Canadians and we're not talking about them. Our parties are not talking about them. They will talk about recovery. Recovery has a 92% relapse rate, and they want to fund beds that are to something that has a 92% relapse rate. So all of these issues on this list all require funding, vast amounts of funding. And where does the funding come from? Well, we raise taxes. And who can afford to have their taxes raised? So I say we take the vast amount that we spend fighting a war on drugs that changes nothing in our community. The only thing it changes is the amount of people that die and the toxicity in the drugs. And we take the vast amounts of revenue that organized crime collects and we tax it like we do marijuana and alcohol. That's reality. And we take those two revenue streams and we have two vast amounts of funds to address mental health, addiction, these questions that are on this list, to fund them. And this will actually make change in our community. So to try and answer these questions as an independent candidate, I don't have a party. I don't have a party policy. I'll do my best to tell you where I stand with the knowledge that I have. And I will tell you that I would support policy on the right and I would support policy on the left. I don't believe any one side has all the right answers, but that policy would have to benefit all British Columbians, not just a party's base. And
45 seconds, candidates.
sorry, I haven't answered this question. So I'm quickly going to say that I was invited to the BC Agriculture Council to hear the concerns of farmers about the issues that are facing them, from climate to cost to you name it. And they had a list that was pretty intensive, and it was funding that they were going to need that hasn't been done to help them address these causes that or issues that were affecting their farms. So, sorry.
How would you access the illegal revenue?
All right, candidates, wrap up your sentence, please. We're going to move on to the next question.
It's okay. When I call for legalization, we have two models to copy. We have our alcohol
Next
system,
question comes from the Comox
and we have our
Valley
marijuana. So you would have a drugstore, a liquor store, and a marijuana store. So you're going to go in and you're going to buy.
Is 2202, and we have seen significant increases in the past 2 years. This burden falls solely on small business owners right now. However, having a decent standard of living is impacted by good public policy such as government income supports, labor market reforms including increased availability to unionization, and accessible and equitable public infrastructure and services that reduce the cost of living and improve affordability. Please give a specific example of a public policy you will introduce or support to reduce the cost of living and improve affordability.
Sorry, so to collect that revenue, I say, from that organized crime is collecting billions. When we legalize, it would just be taxed, just like alcohol is. So Ontario collected $2 billion in revenue from their alcohol distribution, bars, liquor stores, and that goes into their general revenue that supports all the issues that we have. So I want to collect that money. I don't want organized crime to get it. And I want to save the tax dollars that we're spending that changes nothing. And I want to invest those dollars into these that'll actually change our community.
And that would provide housing.
Yeah,
For people who are
100%.
on the street.
So many things.
What I can't figure out is what is getting in the way of the politicians to make these changes? Is it their own philosophical, their own, like, what's...
Yeah, I asked the same question. Like, why? But what it is they don't see votes. I have asked any candidate if they support legalization or if they support the prohibition of drugs. They won't answer you. Won't do it. And I've said from day one, the only way I see that legalization becoming a conversation is the Green Party, the NDP, and the Conservatives all have to go behind a door, and they all have to come out together. And they have to say, you know what? For the betterment of all British Columbians, we have to address reality. And we're going to call on our federal government to change our federal drug policy that addresses reality, and that's legalization. And I say I wish there were no drugs or alcohol on our planet, because I believe we'd be better off. But that's wishing, and that's what our prohibition of drugs does. It wishes it could stop drugs from coming into our community, and here we are today. 6 people have died in our province today, and 6 are dying tomorrow. And they shouldn't be dead. It's
in response to her question, can you talk about what Gord John says about how to change politicians' views?
Yeah, I mean, Gord is an advocate for addiction and, for a lot of things, and I give him credit for it. But at the end of the day, Gord has to stay in party policy, and the NDP federal drug policy doesn't support ending the prohibition of drugs, so Gord can't say it. But he has told me, John, if you want to make change, you have to show political parties that there's votes. That is the only way that they will get in front of it. So I thought, okay, I'm going to run as an independent, and I'm going to ask people for their vote. And I don't ask lightly. Your vote is important to you, as mine is to me. But if people can join and send their voice with mine that says to our provincial and federal parties that it's not acceptable for these people to die a preventable death, and it's not acceptable for you to call on recovery as a be-all, end-all means to save these people when it has a 92% relapse rate, is not acceptable. And because they wouldn't do it if 6 MLAs were dying tomorrow, or if it was 6 paramedics or 6 nurses or teachers, but substance users, there's no votes. And it's...
Would you see the government, like through the medical system,
Candidates have 1 minute,
providing
1 minute to wrap up.
a medical grade
No.
drug, or just open it up and
Open it up.
And whatever happens, and because I'm still worried about the criminal gangs are pretty entrenched,
Yep.
and
They were.
their piece.
Yeah, well, they were before the prohibition of alcohol ended as well, and it didn't happen overnight, and they controlled marijuana. It's a big industry, and it didn't happen overnight, but in time. And what I'm saying, it's going to take time, but we have to start the conversation.
Yeah.
It has to start,
Yeah.
and I want to start it. And by having conversations, and I ask people to have conversations with friends, family, neighbors, and when you have conversations and you hold other candidates accountable for these deaths and lack of action, change will come. You know, we've.
Candidates, that is time up for that question.
I didn't answer that question. I apologize.
Next
Sorry.
question from the Early Years Collaborative. So here's the question.
Yeah.
Research indicates that children in their early years could benefit from support, especially regarding their social and emotional wellness. What would you do to further ensure that the mental and social well-being of children and families is being supported in ways that have previously been lacking?
Well, I'm gonna move it up from the early childhood to late elementary. After I lost our son, I wanted to get in front of school kids from elementary to high school, and I wanted to get in front of the educators as well for different reasons. I wanted kids to hear Ryan's story, to how drug use affected Ryan, how it affected his relationship with his family, what it took from him, how he fought his disease. And I wanted the educators to have empathy for students in their classes that struggled, not to judge them or their families because they didn't know their story. And I wanted those kids that came from families that struggled to know they weren't alone. So there was a number of reasons that I had to get in front of kids and educators. And we do a poor job of educating our youth to the harms and realities of drug use. But more importantly, we don't educate them to the harms and realities of alcohol because it's the gateway drug. I'm a recovering alcoholic. I'm 37 years sober. I never would have tried cocaine if I hadn't had too much to drink. My friends wouldn't have tried cocaine if they hadn't had too much to drink. That's just reality. You lose the ability to make a choice you wouldn't make. And our kids today that have too much to drink lose the ability. 37 years ago, we didn't die. We got to get up in the morning and go, Jesus, that was a stupid thing I did last night. I'm not doing that again. And we didn't die. The kids of today, they die. And that's just reality that's not acknowledged by any party in here. At best, they want to try and save a few chronic users. They're not addressing, there are so many people that are not addicted that are dying. And it disgusts me, to be honest with you, that these lives are not being acknowledged. So we need to educate our kids, and it has to be done, I believe, by people with lived experience like myself, like younger people that are just coming into addiction or out of addiction or in recovery, talking about their experiences. And it can't be once a year the kids get the message. It has to be on a regular basis. And of course it needs funding. When I did this, I traveled between Port Hardy and Nanaimo, and I got in front of elementary to high school, and I phoned our Ministry of Mental Health and Addictions Minister, Judy Darcy at the time, who Jen and I had met. And I said, Judy, you got to fund my gas tank because I can't afford to keep driving up and down the island. And she said, John, I don't have a way of funding you. I support what you're doing. And I said, Judy, you don't need to find a way to fund me. You need to find a way to fund 50 of me because that's what's needed. So our government doesn't, they just don't do it. And our kids deserve it and they need it. And I would fight for that. And, yeah. sorry, evidence, sorry.
You say having science, research, and evidence-based results drive policy. So, I think that's great.
Yeah.
I heard that also from the Green candidate. And so I was just thinking in terms of your comment earlier, how you get the point across to your colleagues. You're also bringing
Candidates have 1 minute.
Yeah.
1 minute remaining.
convince them. Can you look at other countries and say, here's an example of a country which has excluded, or legalized many drugs, like maybe Portugal?
No, there's no other country that's legalized. No. Yeah, I'm pulling the Titanic, and I got slippery shoes on, but it's I'm okay with it. It has to start somewhere, and if it has to start here, that shouldn't prevent us from starting it, because it's right, and it's I know in my heart it's right. How can it be wrong when I'm calling to prevent people dying a preventable death? I don't support organized crime, and I want to stop wasting tax dollars. How can that be wrong? It's I'm on the right side of history. I need help. But
All right, candidates, you have an extra moment while I find the correct piece of paper.
you know what? And I
There you go, I got it. All right, we're going to ask the next question here. This one is coming from the Immigrant Welcome Center. The Immigrant Welcome Center's 2003 needs assessment research showed that many immigrants who live here are employed well below the level of their skills and experience. How would your party reduce barriers to employment so that newcomers are not underemployed?
To finish answering your question on evidence-based, well, we have 80 years of evidence to show us where the prohibition of drugs has gotten us to today. 80 years. It's been an absolute failure from day one. So how many more years do we need? It's not going to change, right? So to these politicians that say, I'll make evidence-based policy, well, except when we're talking about the prohibition of drugs, you don't like that evidence. But that's reality. It's a failed drug policy, and we have evidence to prove it. It's just we don't see votes. So they just keep pouring billions of dollars into it.
Marijuana
And
proved that.
yeah,
They couldn't stop it.
couldn't stop it.
And so they're making the tax money.
Yeah. How many jobs has it created? And, 100% more people are going to try drugs. Just like more people tried alcohol when we legalized it. Put it in shiny stores and you put commercials on TV, it's going to happen. But at the end of the day, kids are going to try it. People are going to try it. They're not going to die. Right? They may or may not become addicted. I was never addicted to cocaine. I didn't get up in the morning wanting more cocaine. I just wasn't addicted to it. Right? Not everybody that tries a drug becomes addicted. Not everybody that drinks alcohol becomes an alcoholic. So are we going to try and prevent somebody from trying a drug that may or may not become addicted, or do we value trying to stop people from dying? I want to stop people from dying. And we're going to be able to hopefully educate people so we don't have as many people trying the drugs. And when they do, if we take these vast amounts of money that I'm talking about and actually put it into medical research so we have a medical intervention instead of a 12-step program, we don't treat cancer patients the way we did 80 years ago, but we treat addiction the same way we did 80 years ago. 12-step program and stop doing what you're doing. And the two support groups that support addiction, Alcoholics Anonymous and Narcotics Anonymous, end in the word anonymous. Everything about addiction is covered in stigma, and there's no Cancer Anonymous. We have to fund a medical intervention and not a 12-step program, and that's why we have a 92% fail rate. It wasn't a choice, it's in my brain, right? It's the changing of my brain. I couldn't stop drinking. It wasn't that I wanted to be an alcoholic. I was just lucky I was a binge drinker. I didn't need a drink every day. I just had to drink for 3 days when I did. It's just the way I drank. Couldn't change it. And I tried. Believe me, at 26 years old, I didn't want to quit drinking because I'd have to leave all my friends. But that's what I had to do. So we need to acknowledge the disease for what it is and how we're treating it. and we're not doing that. Recovery's not the answer. Recovery's the answer. It has to be. We have to invest the funds in medical intervention. So, I'm sorry, I forgot what that other question was. Immigration. Guess what? I'm going to tie that to this too. We got all these people coming to our country, right? We need to warn them. You're at risk of dying. There's 225,000 people that are at risk of being poisoned to death. If you're a substance user and you're coming from Ukraine, you try a substance here, you only get one chance. So that has to be part of our welcome to our country. That's the reality of our country. And no, I know how it. Yeah, we have to support our immigrants. It's how our country has grown. We're all immigrants, and I believe I support it. I support funding new immigrants. There again, I would go to the immigrant center, and I would ask them, what are the barriers? You know, we need to talk about immigrants that come here that are medically trained or engineers, and we don't allow them to simulate into our professions. Yeah. Our government and municipalities are such a part of the barriers for a lot of these issues that it's not addressed. So I support immigration, and I would support funding for that. And I'm going to have the tax dollars to do it. I'm going to have lots. You know, one person asked me, what dollars are you talking about? You throw billions around, and I've tried to find that. And I've talked to too many groups tonight. I don't know if I've said Ontario collected $2 billion in revenue from alcohol last year. Goes into general coffers. And I use an example. The BC Special Forces Unit was formed in our province in 2001. It's 200 RCMP officers comprised out of members in every community. And they were formed in 2001 to fight drugs and organized crime. So what is the cost of 200 RCMP officers for 25 years? Just the direct cost of those guys, because it's made no difference in our community.
4 specific actions you will take to support and foster the growth and safety of the trans community in the Comox Valley.
I support diversity. I would call out the parties that don't have politicized our school system for supporting SOGI. It's reality, and I would there again reach out to the different groups. They have so many barriers that have discriminated against them, and our parties do not do enough to support them. They're people, and it's real, and it needs to be acknowledged and supported. And I would do everything I could to do that. Don't have a party policy to tell you how I would do it, other than I've owned 2 businesses, and in order to survive in business, you have to be able to adapt, and you have to figure things out quickly, because the bank doesn't let you go very long without making payments. And I can say that I do know how to find solutions and source different things. I've done it for a long time, and so I would reach out and contact the people that I need to contact to get that information. And I'm sure I'm missing something, but sweetie, what am I missing? You gotta.
Well, I will say I want to thank you, because I have a 23-year-old son, and I'm just assuming that you were the one who spoke at his high school, because you made a huge impact on him. And I don't think, no parent thinks that their child is going to go down that road, but I remember how, he was so respectful of your experience and your son's experience, and I think that's really great that you went to schools, and I hope you still do sometimes.
No, I haven't. I haven't done it for a while. It's hard. It's and I probably will again. It was just fresh, right? It's 7 years now. It's still a gut punch every day, but the gut punch isn't quite as deep. But because I know it makes a difference, and it's worth absorbing that punch. I spoke to a group of grade 8 students, and I don't know, for 40 minutes. There was 15 of them. My wife is teaching grade 8 boys. And those grade 8 boys didn't move for 40 minutes. And I had the teacher say to me, I've never seen these boys sit for that long without moving or causing a problem. Not a problem, but just, and I've had other students walk up to me to say, I lost my dad, I lost my sister, my mom's addicted, thank you for sharing. So there was a number of reasons why we're not educating our kids as well as we should, and talking about reality. And it is such a problem, and it's such a reason why we are where we are today, because we're just not addressing reality.
And having kids understand that it's not 10 years of use necessarily that kills. It's one use because of all the crap that's in these drugs.
Yeah.
That people die.
Yeah.
Their job in their home.
Yeah.
At a party.
Yeah. Yeah, there's the whole stigma attached to drug use, right? Because it's illegal. Because it's illegal. Right? No, we don't. You don't go out to the end of your driveway and your neighbors say, how's it going today, John? Well, my son's actually in withdrawal right now, and he's fighting heroin addiction. Ryan smokes heroin. You don't say it. That's reality. You can go out and say, my son's got skin cancer or any other disease, but people don't, and they hold it in, and they live with it, and it's nothing to be ashamed of.
But the power of what you do comes from your experience. So when we need more people in the schools, how do we get the message across? Because it's the sincerity that holds their attention.
Then when you have a candidate or someone gets elected as an MLA in the Comox Valley, you need to get in front of them. You need to say, you know what? We're not educating our kids the way they should be. You need to hire people with lived experience to go to our schools on a regular basis. That's what needs to happen. And why aren't you doing it? And when they have people coming in and they look at you and they're going to know you're a voter, they're going to take note of that.
We'll give you a few minutes to do that. The camera folk will follow along.
Thanks for listening. I'm sorry.
Perfect. Thank you so much. All right. Thank you for your patience there. This next question comes to us from the coalition, the Comox Valley Coalition and Homelessness. Many policies aimed at addressing homelessness are not meeting the needs of those most impacted by the housing crisis. How do you plan to meaningfully involve people experiencing homelessness in shaping policies, programs, and priorities that directly affect them? What strategies would you use to ensure their voices are central in developing solutions?
Hello and welcome. I want to just start by telling you all why I'm running as an independent candidate. I think it's important, and it's going to relate to the answers that I'm going to give you guys. We lost our son, Ryan, in 2017 to the toxic supply of drugs. Ryan was 26 years old. He'd been in recovery in New Westminster at a facility, and he went back to work as a third-year electrician, and he relapsed on his job site during his lunch break, and he died. And 15,000 other people in our province and 45,000 in our country have died the exact same way as our son, and the vast majority were in the prime of their life. And there isn't a party, federally or provincially, that wants to talk about why these thousands of people have died, and they don't want to talk about what will actually prevent these preventable deaths, because we know what it is. And Ryan and the vast majority of these other people, the thousands that have died, would be alive today if they were alcoholics. if they had a government-controlled, safe source like we provide for alcohol users. And legalization is the only policy that addresses these lost lives. And it's hard for people, for some, to get their head wrapped around that, but it is reality. We don't have a choice whether we want drugs in our community. The only choice we have is who provides, organized crime or government. And we have a federal drug policy, the prohibition of drugs, that 100% supports organized crime as the only game in town. And we spend billions of dollars, wasted tax dollars, ensuring that they thrive and they're the only game in town. And I want to stop wasting those tax dollars, and I want to start collecting and tax the vast amounts that organized crime collects. And with those two streams of revenue, we could actually invest in so many things that would make our communities better. And all of the issues that are on these lists all require funding. And where does that funding come from? Has to come from raised taxes. I don't want to raise taxes. We've got high enough taxes. I want to take money that we're already spending, and I want the money organized crime's collecting. And I want to invest those. So I'm going to call back to that, but I just wanted you to know why I'm doing what I'm doing, because my wife and I have not had anybody to vote for since we lost our son, because there hasn't been a party, federally or provincially, that wants to acknowledge how our son died and what would have actually prevented him from dying. Because the vast majority would be alive today if organized crime wasn't providing. So to talk about the end of homelessness, we have to provide people a place to live in order for them to move forward in their life. And the vast majority of this has to be funded. And just to give you a little example, if you go onto YouTube and you type in "Elvis is in the building, Port Alberni," it's going to bring up a 9-minute video made by John Duncan, an advocate and retired paramedic. And it tells the story of a man in Port Alberni that lived under a bridge. And he was constantly in ambulances, police car, emergency ward. It was just a revolving door. And they got Elvis a place to live. And it wasn't much bigger than a closet. It was a bed, a little kitchen, and a couple of chairs and a bathroom. And Elvis stopped getting in ambulances, police cars, the emergency ward. And he saved far more than $425 a month that it cost to give Elvis a place to live. So we have 2 modular home builders in the Comox Valley that should be building modular homes quickly and cheaply for housing that needs to be supported. And we've seen government move and implement action when the COVID hit and we were social distancing, wearing masks, getting vaccinated overnight. And we've watched government make change when our Coquihalla Highway washed out in the middle of winter. And that highway was rebuilt within months. So if government wants to do something, they can do it. And it's not being done. And we need to hold them accountable for this lack of action on the people that are living in tents on Cliff Avenue and around our community, because they shouldn't be in tents. So I'm going to keep coming back to it. Where does the funding come from? We already have it. We're just spending it in the wrong places, and we're allowing organized crime to collect it.
Okay, candidates, time to wrap up that question, and we are moving on to the next question. The next question is from the Comox Valley Senior Support Society. And here's the question. Affordable, accessible, and interconnected public transit can address many social issues, including equality and inclusion, climate change, and quality of life. How do you perceive the role and future of public transit? What changes, if any, would you work towards or advocate for in public transit improvements in the Comox Valley, Vancouver Island, and beyond?
So I also didn't talk about being an independent. I don't have a party policy. So to answer these questions with 6-minute answers, I just don't have them. But I have owned a couple of businesses, and as a small business owner, I know how to source information and find solutions. owning a business, you don't have months to figure things out. Banks, they don't give you a lot of time. So I would reach out to the people that are in charge of transit and the people that use transit, and I would reach out to them to find out what we're missing, what needs to be changed, what's the priority. To touch on seniors, what jumps out at me is the amount of seniors we have in our community and across our country that are trying to survive on an old age pension and a Canada pension. They have no other income. For whatever reason, they haven't been able to save a lot of money. They don't own a home. They're just trying to survive on 2 pensions that don't pay enough for people to live. And I think when our seniors, people get to that age, we need to find a way to subsidize people that are trying to make it on those 2 pensions with the cost of living, and they're hoping that the pensions go up 2 or 3% if they do. And we're not talking about that enough. These are people that can't go out and work anymore, and we need to address and acknowledge that we need to support them. And guess what? Where does the funding come from? Comes from the vast amounts that we're not collecting and spending the wrong way. I want to talk about recovery, because that's what all of our parties call for as the be-all, end-all means to stop people from dying these preventable deaths. And when they throw out recovery, it's a gut punch, because recovery has a 92% relapse rate. So they want to invest billions in recovery beds, something that has a 92% fail rate. And it's a faith-based 12-step program, mainly run for profit, unregulated facilities that basically tell a person to stop having their disease. And we need to invest in medical research that provides a medical intervention to a disease that is a changing of the brain. We look at cancer patients, and we don't treat cancer patients the same way we did 80 years ago. But if you suffer from addiction, you're going to do a 12-step program, and that's what was introduced 80 years ago. And we need to acknowledge that we're just not investing in giving people a chance other than that 12-step program that tells people to stop. The 2 support groups, Alcoholics Anonymous and Narcotics Anonymous, that support addiction, end in the word anonymous. And I've talked to some friends that are very involved, and I've said you have to change the name. It covers someone that fights a disease in stigma when they have to go to a support group that ends in anonymous, because there's no Cancer Anonymous or Diabetes Anonymous. And I can't seem to get much headway on that, but I'm not going to stop. And our language is so important. We need to stop talking about people that are in sobriety being clean for 4 years, because it insinuates that they're dirty when they're fighting the disease of addiction, and there's nothing dirty about it. So we need to use the right language. We need to talk about reality.
I think it's a little less than 1 minute. 1 minute.
It's not being addressed. We're not addressing that and I'm probably repeating myself now, you guys, I'm sorry, it's been a long day, but that we spend billions ensuring organized crime thrives in every community by supporting the prohibition of drugs. Yep.
I have a question for you. So, well, first off, I just really appreciate your words. Thanks a lot. I can just see the passion and thoughtfulness there. And I think it's really great to, stand for office and put the message forward. I guess I'd ask you, of the major parties that are likely to form government, have you looked at their policies around drug use and
All right, candidates, wrap up your final sentence, please. We're going to move on to the next question.
Both provincially and federally I have. I didn't want to do this. I really didn't.
Next question comes from the Comox
but-
Valley Social Strategy, which is a program operated by Indigenous women,
Just to quickly answer your question, there isn't a party that is truly trying to save all users from dying. They are all trying to minimize a few chronic users. I can't do that. All lives matter. They're not addressing kids, the 150 youth that have died. No party is. No party is addressing the recreational user, the first-time user, and the vast amount of chronic users. I'm a recovering alcoholic. I've been sober 37 years. I never would have tried cocaine if I had too much to drink. I was never addicted to cocaine. And 37 years ago, I would have died with the drugs of today. Because somebody would have brought it out, I would have had too much to drink, and I would have died. And there's no party in this room or federally that is acknowledging people like me, kids, and first-time users are dying because they're not addicted. It's just, they're ignoring that reality, and it's a gut punch, and it's disgusting. It really is. And the other thing, they're chronic users, all of our alcohol users would not go to recovery if our alcohol stream was toxic. They're just not gonna. That's not reality. So I wish there was a party, and I've said to my wife, and I've said to a number of people, the only way I see it happening is our federal or our provincial Greens, our provincial NDP and Conservatives all have to go behind a door. And they all have to come out from behind that door. And they have to say, you know what? For the betterment of all British Columbians, we're calling on our federal government to address reality and stop our federal drug policy that only supports organized crime and plays a major role in all these deaths. But they won't do it because they don't want to be the first party. Can you imagine how the other parties would slam them? They're calling for the legalization of drugs. That's insane.
So a safe supply would be another thing.
No, I don't want safe supply. It's a harm. Don't get me wrong. I shouldn't say that. It's saving lives, 100%. But it's picking who it's saving. I can't do that. It's not, safe supply doesn't apply to kids. It doesn't apply to recreational users. I would never have gone to safe supply. We got to talk about everybody that's dying equally.
I have two questions about that. So the one is, my understanding is that now that fentanyl has come here,
Yeah.
there are people who like to
Yeah.
use it, right? So yes, toxic and unregulated drug supply, you don't know what you're getting. But I guess what we're saying then, if we go the route that you're suggesting, is these things are available in a regulated manner to be sold to whomever, and we would still have to, I guess, provide options like fentanyl for those users who want to have that type of high. Is that what I'm hearing?
Yeah. Yeah.
Okay. And then the next question is, so obviously on like a drug policy scale, there's prohibition, which we know is not effective and very harmful based on history. And then there's full sort of
Legalization.
And in my understanding, the literature kind of shows like a U-shaped curve where on a population level, right, the most harms occur on either end of that scale, right, where free access makes it seem like this is something that's not a big deal.
Free access or legalization? Yeah.
Full legalization makes
Yeah.
it seem like something that is acceptable for one to experiment with, right? There's no sort of social pressures to avoid drugs that are quite harmful,
Yeah.
as we know, and also much more addictive than many other things, right? There's that level of
Yeah.
Let's have 1 minute to wrap up.
It's a great question. Yeah, it is 100%. And what I would say is, so we have a choice. We can prioritize people not having access, and that hoping that that they may or may not become addicted, or we can stop people from dying. So for me, it's clear cut. I want to stop people from dying, and I'll take the risk that someone may or may try, and may or may not become addicted. And at the end of the day, we need to change the source of drugs to remove the toxicity. And it's not going to happen overnight. It's going to take time, but we have to start. And the other thing I would say to that is we don't educate our kids well enough to the harms of drugs and alcohol, especially alcohol, because it is the gateway drug. I and most of my friends that first tried drugs would never have tried them if we weren't drunk.
And
Way
with
too much to
that,
drink.
we're on to our last
So we need
question.
people like myself and other people with lived experience getting in front of students to give them the realities of alcohol and drugs. But that's a great question. Yeah.
Thanks for your answer. That was actually really.
Way to go. We're
Yeah.
almost there. Finishing strong. Okay. The Comox Valley agricultural community is facing several challenges. This includes high land prices, increasing cost of getting inputs to the island, and climate change. How would you support farmers in the local food system?
I missed the last question completely. I'm sorry. But it does talk about our Indigenous community, and it's not acknowledged that our Indigenous are hit so much harder than non-Indigenous people. They make up 4% of our population, and they're 16% of the people that are dying. The Indigenous have 6 times more likely to die than non-Indigenous, and Indigenous women are 11 times more likely to die than non-Indigenous. So there's so many issues that have not been addressed with the Indigenous community that need to be, and from discrimination to racial to that all play a part in their numbers being far more than non. And I just said to this young lady that we don't educate our kids well enough to the harms of drugs and alcohol, especially alcohol. It is the gateway drug that we put on every corner. We make it accessible. We have to have it on BC ferries now because that ferry trip's too long to not have a drink. And we need to have people going into schools with lived experience. I did it for a number of months right after I lost Ryan. I went to schools from Port Hardy to Nanaimo. And we need to have so many more people that have lived experience on a regular basis going into schools to talk to our kids, to tell them the realities that they're facing, because the kids of today don't give them another chance. That young lady that died in Victoria in January, 18 years old, she's in a dorm with her friends. It's safe, it's good people. Too much to drink. Her mom's an ER doctor. She knows, but she loses the ability to make that decision that she normally wouldn't make. And she takes a substance and she dies. And there isn't a party in here that is talking about that 18-year-old girl. Because recovery isn't saving her. She wasn't addicted. She just made a bad choice. So when I ask people to vote for me, I don't do it lightly. Your vote is important to you, as mine is to me. But governments will see voters, and they will change, and they will make policy decisions based on votes. So I ask people to support me and be a voice for those that have died and those that are at risk of dying. And we need to tell government clearly that it's not acceptable to allow people to die a preventable death. And it's not acceptable to not talk about which would keep them alive. And it's not acceptable to spend billions of tax dollars that changes nothing in our community. And we can show them voters, because I've been told, we show them voters, they will change. And it's a bit of a challenge. But at the end of the day, it's just reality. We're not addressing it. You know, we look at Cliff Avenue and we say we've got to have voluntary or involuntary care. Well, why? Why do we need that? What's changed? Because we weren't talking about it 10 years ago, and Cliff Avenue didn't look that way 10 years ago. Well, the toxicity of drugs have changed, and we have so many more people that have lost oxygen to their brains for 2, 3, 4, 5 minutes, and they have severe mental health issues now. Permanent brain damage for the rest of their life at an age of 25, 26, 27. What does that cost to our healthcare system? And that's why. But we're not talking about why people are behaving so much more erratically than they were. And it's just little band-aids that they want to put. And it's not addressing reality. So until we address reality and acknowledge it, We're not going to change. Our communities are going to get worse. Our kids are going to continue to die. And we're going to spend billions of tax dollars that changes nothing. And I wish there were no drugs or alcohol on this planet, but that's wishing. And it's not reality. And our federal drug policy wishes it could stop drugs from coming into our community. It's not reality. And I ask all of you to have conversations with friends, family, neighbors. This change will come when these other parties know that we're talking about it and we're not happy and we're not going to accept it anymore. Because your kids' future is at risk. You know, if you have kids, if I'm lucky enough to have grandkids, they're going to be at risk.
Time. And with that, we're wrapping up. So I just want to thank all the candidates for their engagement. I want to thank all of you that came to listen or are engaged in what's going on in our community in terms of politics and these important questions. Don't forget to get out to vote. Don't forget to bring your friends to come out and vote. Get everybody to vote. Super important.